love when I get these questions from young people who just haven't even embarked on their sexual journey yet. Says, Madam, I have not had sex with anyone to date. The cap of my penis doesn't open. I'm 29 years old. Will there be any problem having sex after marriage? What a great question. It's packed with innocence and joy and a medical question. So I'm gonna start there. So I want you to think about, the penis when you come into the world, you're born with a foreskin that actually covers up the head of the penis. Now, this is my daughter's sock, and I picked it because it's got the black tip and the yellow, so you can actually see it, right? So if you come into the world like this, then ideally, as you grow, you're able to retract the foreskin and the head of the penis comes out, right? So some gentlemen their parents opt to get them circumcised, some not. An estimated 67% of the male population is circumcised and the rest is not. So for this young gentleman who wrote in, actually his foreskin is stuck here pretty much, so he cannot pull it back to actually have the head of his penis pop out. So this is a big thing. We actually, there's a term for this. It's medically called phimosis. And phimosis is when your foreskin can't retract. Paraphimosis is basically when the foreskin is stuck back. Like you're uncircumcised and your foreskin is here. It's kind of causing like a constriction band across it, and it's stuck. You can't put it back. So that would be paraphimosis. But for phimosis, for a gentleman whose penis, the foreskin is stuck here, really the goal has to be to get the foreskin retracted. So there are two things to think about. Since you're already 29 years old and not 15 or 14 or 20, I would venture to say you have probably some adhesions underneath here, because it's the head of your penis hasn't been getting any air, or you haven't been able to clean underneath it. You haven't been able to do much with it. So generally speaking, depending on whether or not you are living in a country where you have access to health insurance or can walk into the doctor's office and not have to pay, really kind of depends, because we all have different access to care. So if you don't have access to care and you can't go see a urologist and the urologist do it for you, then your goal ultimately has to be to try to kind of stretch and pull this foreskin back without it getting stuck. Now, this is a very gradual process. This basically means here in this country, what we would do is take some steroid cream like hydrocortisone or triamcinolone, and we would use it to start trying to kind of break up the adhesions or the stickiness there. And we would use it also as part of the therapy process to kind of stretch, putting two fingers here and just kind of trying to pull it a little bit, kind of stretch. And then just gradually, after you put your ointment on it, you're just gradually kind of pulling it back to see if you can stretch it. And, you leave it kind of like that for 15 minutes or so, and then you relax it. You're done for the day. So it's a gradual stretching process to try to remove and to pull it back. Now, the other piece of that is that, clinically speaking, here in the United States, if someone has insurance, they would go see the urologist. The urologist technically could either surgically pull it back or surgically remove the foreskin, depending on what the patient wants. And when you have no access to care like that, then your best bet is going to be to actually kind of gradually stretch and gradually pull over time, just taking your time, stretching and pulling. If you don't have access to steroid types of creams, you can use things like aloe vera gel with a little petroleum base. You can use things like black seed oil, something that's going to give you a little bit of an oily substance so that you can actually start kind of trying to stretch it so that your goal becomes to gradually pull it out without it getting stuck, and so that it moves back and forward like you need it to be. Okay, so that is a condition that in some places a surgery would be needed or wanted, but there is plenty of data that's clear that you can actually do the stretching and the repositioning yourself. Just look it up. It's actually called phimosis, Phimosis. Great question.